Well, over the years, Merck Animal Health has pioneered multiple vaccine innovations, including the use of intranasal technology. Merck's comprehensive vaccine portfolio includes 5 BQA-friendly intranasal vaccines. Hi, and welcome to Rural America Live. I'm Tammy Arender. We are live with Merck Animal Health, talking about their newest vaccine, BOVILIS NASALGEN 3PMH, the first and only intranasal vaccine of its kind, providing protection against both viral and bacterial pneumonia. And that means protection against IBR, BRSV, PI3, plus Mannheimia, haemolytica, and Pasteurella multocida. We are now joined by Merck Veterinarians, Dr. Chris Schneider and Dr. Chris Thomsen. Thank you so much for being with us. And Dr. Schneider, let's start with you. Introduce yourself.
Yeah, well, thanks for having me, Tammy. I appreciate it. My name is Chris Schneider. I'm a veterinarian, as you said. I live in the northeast of Washington, Spokane, and in my practice career, well, a little bit about my bio. I've been in private practice and exclusive cattle practice in Central California. I've been in academia. I was a professor of infectious cattle diseases at the University of Idaho. And I've also served as a consultant for animal health companies for about the last 10 years. So I travel the Western United States and work with cattlemen and women and try to help them with common problems they have. I probably should give a shout out to all the Freeman, Washington community. I know many of my friends and family are watching, so go Scotties.
All right, very good. Dr. Thomsen?
Well, it's a pleasure to be here. My name is Chris Thomsen, also a veterinarian. I grew up in Central South Dakota, graduated from veterinary school at Kansas State University. I spent 15 years in private practice, started out kind of in the feed yard industry in Western Kansas, and then transitioned to more of a cow-calf type of practice. For the last 6 years, I've been working with Merck Animal Health as a field-based technical services veterinarian, supporting kind of the northern plains up through the Dakotas, Wyoming, and Montana. And I'd like to give a shout out to my wife and kids at home in Belle Fourche.
Love that. We got to give the supportive wife a shout out. Let's start out by talking about bovine respiratory disease, the main thing we're trying to tackle here. What's the impact on the herd? How did it get started?
Yeah, bovine respiratory disease, or BRD as we commonly call it, is kind of a passion of mine. Ever since being in private practice and working with cattlemen and women and trying to seeing the disease in action and seeing its effects on both the cattle and the humans that are responsible for the cattle. It's a tough disease to deal with, and I don't think we've made a lot of headway over the years. We hope innovations like we're going to talk about tonight will help. It's been estimated that the disease costs cattlemen and women $900 million a year. And that cost is major, and it comes from a couple sources. Basically, there's a direct treatment cost, so the drugs and labor that we use to treat the sick cows and calves. But also, one thing people don't think about as much is the loss in productivity that we see with bovine respiratory disease. There's a lot of scientific studies that would show us that if a calf gets bovine respiratory disease, it's not going to perform like it should in the subsequent phases of production, like the feedlot, for example. Another thing I'd point out is we spend a lot of money, both beef and dairy, on genetics and what we call genomics. Producers invest a lot of money into their cattle. To get the payback on that investment, you need to produce healthy calves that don't get bovine respiratory disease, because if they get bovine respiratory disease as a calf, they'll never really reach their genetic potential. Or if a bull gets bovine respiratory disease as a calf, it really won't ever grow into its performing capabilities. So it's a major disease, very, very costly, and really something that I think the cattlemen and women are very keen to prevent if they can.
Let's talk about the incidence of BRD and the U.S. cattle industry. How common is it?
Well, unfortunately, it is quite common. And, you know, the main age that we're talking about that gets affected is anywhere between birth and probably say up to 7 to 9 months of age. That's where we see the majority of our cases. You know, in the dairy industry, we're talking 25+% over the course of their development will develop respiratory disease. And they will also have a pretty high incidence of GI disease as well on the dairy side of things. When we look at the beef industry, our respiratory disease incidence is upwards of 30%. So it's a very high number, and like Dr. Schneider said, it's a very, very costly disease when you have that high of a percentage of animals that are requiring treatment.
Do we know how it actually develops and gets started in an animal?
Yeah, we do. And if we go back and if we look at the anatomy of the respiratory tract of a bovine, especially if we compare it to something like a horse, they're both similarly sized animals, 1,000+ pounds. A bovine has roughly 30% of the lung capacity that a horse does, but yet requires 250% more oxygen than a horse does. So if a calf gets respiratory disease, they have very little extra lung tissue. So any disease that's present is definitely going to stunt their growth and affect their performance throughout their lifetime.
Right, and I know you gave a very large number there in the beginning about how this impacts a producer's bottom line, but
Yes.
What are we really talking about there?
I think the audience will be really familiar with their reputation when they market their cattle, whether it's beef or dairy, whether you're a dairy calf raiser or a beef producer that's marketing their cattle to the local sale barn or through contract on a video auction. The reality is the direct impact is if you get a reputation for producing quality animals that the person in the next step of the production cycle can take and raise to the end, they're going to come back to you. And I think there's a lot of examples in the industry today, both beef and dairy, where if you get a reputation to produce a quality animal, you get a premium. And conversely, like I said, if you have struggles with bovine respiratory disease, it's going to directly impact you in your pocketbook. I think anybody that's bought the newer generation antibiotics and realized that they're relatively pricey understands that prevention is probably the key to dealing with bovine respiratory disease, so you don't outlay that cost, which it can add up in direct treatment costs.
So interesting that you bring up the critical point of reputation and that cattleman's reputation, because my daddy used to say that the only thing you can take to the grave with you is your reputation. So if you know you're taking premium cattle to the auction, that's going to follow you everywhere you go. Let's talk about the big 5 pathogens.
So BRD is definitely a multifactorial disease. We have, external stressors that can be involved, as well as viruses and bacteria. And some of the major ones that are commonly involved in acute respiratory disease include IBR, BRSV, PI3. Those are all viruses. There's some other viruses that can be involved as well, such as coronavirus and BVD virus. When we get to the bacterial side of things, Mannheimia, haemolytica, and Pasteurella multocida are by far and away the 2 most common bacteria, but that's not an all-inclusive list. We have other bacteria that can definitely be involved in causing respiratory disease as well, such as Histophilus somnus and Mycoplasma bovis. So there's a whole host of pathogens out there that we can attribute bovine respiratory disease to.
Talk about how the respiratory tract actually becomes compromised in the bovine.
So in the natural state, the bovine has a great natural defense mechanism. Our sinuses and upper respiratory tract have a mucus lining. Our trachea or windpipe has something called a mucociliary apparatus that works to flow uphill, basically, to prevent anything from getting into the lungs. When we have insults, whether they be external stressors such as, smoke inhalation or transportation, if we get some diesel fumes or something like that, heat stress, cold stress, all those things can take their effect on those natural defense mechanisms. The other insult we can deal with is viruses that will directly affect those defense mechanisms. When those defenses get bogged down a little bit and aren't functioning properly, that will allow those viruses or even bacteria direct access to the lungs. Most of the bacteria that cause respiratory disease are normal inhabitants in the upper respiratory tract of cattle. They are there all the time. And a normal calf, it'll never cause them a problem. If we have some external stressors or a viral insult or something, it'll allow those bacteria access to the lungs where they can do devastating damage.
Talking about those stressors, right now with the wildfires and all the smoke out in the western U.S., I mean, for cattle producers, that's got to be serious.
Yeah, I kind of look at it like a human analogy. It's the same for us that live in the West and across the United States. Yeah. Any of those environmental stressors, the smoke, the irritants, I think we can all relate to the tickle in the back of our throat, right? Mm-hmm. And our calves are no different. The bovine respiratory disease usually starts up in the upper airway, and really what we're trying to prevent are deep-seated bacterial infections in the lungs. So when you look at prevention strategies, they're essentially designed to block that tickle in the back of the throat and prevent deep-seated bacterial invasion, which would require antibiotic therapy. And when we treat with antibiotics, it's expensive and time-consuming. So we do everything we can to prevent that when we can.
Right, being proactive. Now, of course, we are here to talk about the vaccination. How exactly does a vaccination work in the animal?
The goal of vaccination is really to expose an animal to a potential pathogen in a safe way so that they recognize it as a foreign invader and they turn on their immune system's machinery to say, this is a foreign invader, we don't want this bug here. And we develop antibodies that can directly fight it, and we also develop memory cells so that if in the future that animal is exposed to that pathogen again, it can respond very, very quickly and prevent an infection from occurring. So it's very important to get our vaccines into our animals, one, when they're healthy, and two, before periods of potential stress or other things that could predispose them to respiratory disease.
So interesting. The science and technology is still so fascinating to me that you say that body can actually remember that once you put that vaccine. Talk to me about the importance of vaccination for profitability. I mean, I know being proactive, it's obviously got to be a positive.
It's probably one of the bigger drivers of profitability when you really look at it. I think one of my old veterinary professors told me and told us, he said, you know, in general, you're not going to treat your way into profitability or you're not going to treat your way out of disease. And I think that's a good take home for the audience. Treatments are fine, but when we're treating the broken, i.e. calves that have bovine respiratory disease, that's a cost. And that's a cost that's really difficult to overcome because you have the upfront cost, like I talked about, and then also the productivity losses. So really, you're much better ahead to prevent the disease, spend your money on prevention, and then keep that money in your pocket. If you produce a calf that has struggles with bovine respiratory disease, they never quite look right. I'm a cattleman too, and I know the calves that have gotten sick under my watch. They just never kind of perform. The buyers identify them very accurately when they see them come through, and they consequently they dock those animals. I don't care if it's a beef producer in the southeast, a beef producer in the western United States, or a big dairy calf raiser. The buyers are trained to look for those type of animals and to pay less for them because they understand the loss of the productivity aspect of it. So it really, really behooves us, all of us that are in the industry, to prevent the disease when we can. Put our money there.
Instead of just treating it.
You know, another thing that where we look at profitability is there's a lot of cattle that get sold through special sales and kind of program type cattle, video auctions, that kind of thing. And, you know, Merck Animal Health has a program called PrimeVac. And it's just basically a set vaccination protocol that you put the cattle through. And by doing that, we know that we can add profitability to a producer's bottom line, whether it's by adding the vaccines in or by weaning cattle for a certain number of days before they get sold and move to the next stage of production. We know that we can garner premiums anywhere from $15 for vaccines alone up to $50+ a head if we include weaning by doing these management practices before we enter the next stage of production.
So what do we do now to handle BRD?
Yeah, I think it's a combination. It's a combination of prevention and treatment. Traditionally, right now, we vaccinate our cattle at certain times. A lot of those vaccines we still use to this day are injectable type of products that are designed to stimulate certain aspects of the immune response. We try management factors to control for BRD. Dr. Thomsen just alluded to one, which is the PrimeVac platform, which would, part of that platform is you wean the calves and you hold on to them. You don't ship them right off the cow to the sale barn, so you reduce stress. Mm-hmm. So there's a bunch of management related things we do to handle BRD now. And then when we do have breaks and problems, we come in with appropriate antibiotic therapy, the right type of antibiotic that treat the disease for the right duration. And that's super important. And I think we've got a lot better in all those three things over my practice career: prevention, management factors that can control it, and then adequate and appropriate therapy. With that said, we still struggle. So there must be something we're missing. And that's where my passion lies, is where are the innovations that can allow all of us to reduce that 20 to 30% incidence of disease and put money back in our pocket and then produce the healthiest animal we possibly can.
Right. There are enough other problems to face without
Absolutely.
having that. We need to take care of
Absolutely.
this one. What would you say would be the biggest advantage of the intranasal vaccine?
Yeah, to me, it's an innovation and understanding mucosal immunology and then understanding how to take advantage of that is important. People much smarter than I have kind of figured that out. So I'm a basic man, and the basic concept is I know the portal of entry for these bugs is usually through the nose or the oral pharynx. So they kind of come in through the nose, and then I want to keep them there or block them there, right? And so if I can design and get a vaccine that would cause local immunity at the portal of entry, i.e. the nose, then I can effectively block the pathogens so they don't get deep down in the lungs. So ultimately, these types of practices allow us to have less stress on our calves when we give them. They allow us to use a lot of different products at the same time that we might not be able to use if we're using just exclusively injectable vaccines. And ultimately, they add money and productivity to the animal. So intranasal vaccines, in my opinion, are really the way to take that next step in prevention for bovine respiratory disease.
Makes a lot of sense. Now, I noticed the BQA logo
Yeah.
on there. What's the biggest advantage and importance of having vaccines BQA friendly?
So BQA's been around since the early 80s, and it was a way for the industry to progress to avoid, drug residues in carcasses, injection site lesions, and the industry progressed very, very rapidly into addressing those goals. As we continue to move forward, the main goal of BQA is to provide a safe, wholesome product for the end user, from animals that have been cared for very, very well from conception all the way to consumption. So, being BQA is important. Anytime we can leave a needle out of an animal, it's a wonderful thing. Mm-hmm. It's less stress on the animal, and it's less stress on the humans that are taking care of those animals as well. So that's a big part of what Merck Animal Health does, is we try to have very smooth products and very BQA-friendly products.
What else would you say would be some of the most current challenges and of the current practices that are going on right now?
Maybe I'll speak a little bit to the dairy, or just in general. Nobody likes change. So if you've done something, I go on farms and ranches, and that's the way we've always done it. So when you bring an innovation, i.e. intranasal vaccination, to the marketplace, people are like, well, I'm not used to doing that. I'm not set up to do that. So there's a little bit of resistance. Mm-hmm. Tell me more about that. Let me understand how that's going to work on my operation. So I think as we've rolled these out, these different products over the years, we found that if you adopt intranasal vaccination, you get the benefits, and it's just not that hard. So there's a little bit of managing existing practices and convincing people this is the right innovation for them to pick up. And we see that both on beef and dairy.
You want to add anything to that?
Yeah, I think another thing that we still deal with is, we've got basically two different types of vaccines that we deal with: modified live vaccines and killed vaccines. Some vaccines are only available in a killed format, such as our Clostridial vaccines. They have their advantages, but they also have some disadvantages. We have to give a booster dose, so we have to work those cattle a second time, roughly 3 to 6 weeks after the first time, which adds more labor, more work to get that immune response and get that protection we want. When we talk about our respiratory vaccines, we've got both modified live and killed. And I think our modified live vaccines have some really, really good advantages. One dose is usually enough to get us pretty good protection for the duration of the product. And not only do we get a good antibody immune response, which will help fight disease directly, but the modified lives are very good at stimulating immune memory, which really helps us provide for the future. Again, like Dr. Schneider said, change is difficult, but I think moving towards modified live vaccines and even the intranasal vaccines is a very good thing for the industry as we continue to fight BRD.
All right, so we've talked a lot about BRD. We now know its history, its development, and what it does to the animal. Let's talk about Merck's Solution very quickly before we go to break.
Yeah. So BRD is a costly disease. We know that, $900 million plus a year. We know that it's a disease we still face on a daily basis. So Merck Animal Health has brought some innovations to the marketplace that are going to help us control that. Specifically, this vaccine we'll talk about in the next segment, BOVILIS NASALGEN 3 and BOVILIS NASALGEN 3 PMH. So it's our attempt to bring a solution to probably the most relevant disease in the industry.
All right, can't wait to talk about it. We do need to take a short break. We'll be right back with Merck Animal Health, and we'll open those phone lines shortly. Stay tuned. Well, welcome back to Rural America Live. We are joined by Merck Animal Health, veterinarians Dr. Chris Schneider and Dr. Chris Thomsen. Now, before we learn more specifically about BOVILIS and NASALGEN 3 PMH, talk to me about Merck's intranasal vaccine portfolio.
So Merck's been a pioneer in the intranasal vaccine space, going all the way back to the early 1970s when NASALGEN IP was introduced to the market. That was the first intranasal vaccine that was ever introduced to the cattle market. Since that time, Merck has continued to expand their intranasal vaccine line, adding 4 more vaccines up to the present time. Our latest introductions roughly a year and a half ago was BOVILIS NASALGEN 3. And then just this past January, we were very pleased to launch BOVILIS NASALGEN 3 PMH to the market.
And let's talk about the differences in that. What is the difference?
Yeah, you know, I'm passionate about bovine respiratory disease, and I've spent most of my career trying to find a solution. And so when I think about BOVILIS NASALGEN 3 and NASALGEN 3 PMH, I use words like innovative. I use it's different. But what does that mean? And so I think when you're the newest on the block and you bring in innovation, I know this, we were held to the highest level of scrutiny by the USDA, the licensing arm. So they had us go out and prove 2 things. We had to prove that this vaccine was safe, and we had to prove that this vaccine was efficacious. And so I can stand here and be excited about this BOVILIS NASALGEN 3 PMH and say that we have the most current data in the marketplace on this particular product. We have a 30 years of experience with bringing intranasal type of products to the marketplace. And at the time we launched these vaccines, we have a credible amount of data that would show that they work. And so that's really, really important to all of us in the industry.
What benefits does that provide to the producer?
So confidence that the vaccine works. You don't want to buy a product and spend your good hard money on something that you're not convinced actually can provide value immediately for you. Another feature of the BOVILIS NASALGEN 3 PMH is it combines viruses and bacteria into one convenient dose. So you can give it at one time. Another feature that veterinarians just love, and producers will love too, is we have established how long the minimum days in which this vaccine will be active. So as you design vaccine protocols, we call it duration of immunity. And so we have published duration of immunity so we know how long to expect the vaccine to work. That's really important if you're a stocker producer and you hold on to these animals for a defined period of time and you want to make sure that you have immunity to cover the risk period. Mm-hmm. It's really important if you're a calf raiser in Southeast Idaho and you know you want to span the weaning process for protection. You want to know how long these vaccines work. So duration of immunity information is really important. We have it. Efficacy data is really important, and there's a plethora of efficacy data on this vaccine, and we know it works, and we know it's safe. So producers and veterinarians should be confident that this will work for them.
Anything you'd like to add to that?
Well, there's a couple other things that I think make it unique. One is the blue shadow diluent that is in the vaccine. So when you actually administer the vaccine, it leaves a blue dye in the calf's nose, kind of marking that vaccine, that calf has been vaccinated. You know, this spring we went through branding season up in South Dakota, and I talked to a lot of producers that use the vaccine, and they absolutely love that blue shadow. They knew that when that calf's nose was blue, it was done. It was time to move on to the next calf, and can also be used for compliance to make sure, you know, if we have a whole crew working for us, we can make sure that they're doing their job correctly, you know, just by looking at the color of that calf's nose.
The evidence is there. How do you see cattlemen actually using the product?
So we're not quite through a full year with this vaccine yet, but so far I've seen the vaccine used in a lot of different ways. I was up in North Dakota in February and it was 50 below, and we had guys calving through barns, you know, trying to give those calves some protection. You know, within a few days, they're going to be turned out into a very cold environment. So we saw a lot of it used in those very young calves, you know, a week of age, getting some protection into those calves before they went out to see a very challenging environment. The biggest use I've probably seen so far is in our branding age or turnout time vaccinations. You know, we're gathering these calves to work them to do branding and other husbandry procedures. We give them our vaccines. That's where I've seen a lot of use of it. And it's really been put to the test this year with our hot and dry conditions up in the western U.S. this year. I have heard of some other people using it, you know, on arrival in a feed yard type of situation. And given the conditions out west, I've had a lot of conversations with both veterinarians and producers who are looking to use it in a pre-weaning type of situation. So they want to vaccinate these calves before they take them off the cows this fall. They're probably going to be doing that earlier this year due to the drought. And they're looking for a nice low stress way to give these calves some good protection to get them through the weaning process.
What about in dairy cattle?
Yeah, and so dairy is a unique situation, and when we can predict when we have disease because we have a lot of data, especially in the large calf raisers, and so we know we struggle with pneumonia in hutch calves about 30 days of age. So we see this product, it's labeled to use in calves 7 days of age or older. So I've seen a lot of adoption with BOVILIS NASALGEN 3 going in about 7 to 10 days of age in the hutch. We also see calves have stress pneumonia around weaning, about 60 to 90 days of age. And once again, the flexibility of the BOVILIS NASALGEN 3 is it allows us to apply the BOVILIS NASALGEN 3 PMH, which includes the 2 bacteria, at that stage of production. And then again, when we move them into what we call group pens. But the bottom line I want the viewers to consider is this vaccine is very, very flexible and it's fast. So we use it ahead of known periods of stress, and we use it when we know we can anticipate bovine respiratory disease. And it will mount an immune response in the matter of days. And so if you have a stressful event coming up in your cattle or calves, thinking about intranasal vaccination with BOVILIS NASALGEN 3 or NASALGEN 3 PMH is a really good way to think about preventing disease that you might normally have.
Absolutely. Now, you've mentioned a lot of the research and science, and especially I know USDA definitely puts you through the rigors. Let's talk about some of that data and some of the proven science behind it.
Yeah, so when we launched the vaccine, we had to do what we call challenge studies. So in basic terms, you vaccinate a group of calves, you leave a calf group unvaccinated, and then you challenge them with the agent of interest. So, and then you compare the 2 groups. We did that for all 5 antigens or bugs in the NASALGEN, BOVILIS NASALGEN 3 PMH brand, and it passed with flying colors. We were able to demonstrate clear efficacy for all 5 pathogens for bovine respiratory disease that are in the vaccine. And we've published that. So if the audience is interested, we can refer them to a website at the close where they can check out the details. Okay. Perhaps the most interesting thing to me, and I'm a big data guy, I work in the dairy industry, so I have a lot of data, a little bit more of the testimonial. How are people that I trust, what data is coming back from the field? And over and over and over again over the last year, I'm getting credible data coming back from veterinarians and calf raisers that say we've used BOVILIS NASALGEN 3 PMH in this scenario, and it's worked really well, and we've been able to see the incidence of disease go down. And that's really, truly, the devil's kind of in the details, but it's in the field where we kind of gauge the response, and the response has been overwhelmingly positive.
Right, so you've heard some success stories too, I'm sure.
Absolutely, you know, and in addition to the efficacy studies that we had to do, we also did duration of immunity studies on every antigen in the vaccine. So we have some idea of how long the vaccine we can expect it to last. We also went through some very rigorous safety studies to show that the vaccine is safe. We've tried it in lots of different classes of cattle, and we know that the vaccine is safe to use, which is key. And, you know, like any new product, we continue to do research on the vaccine. We've got several studies underway right now where we're looking at it in different areas of production to see how the vaccine does. But as far as, you know, feedback from the field, I've gotten a lot of feedback from people that have used the vaccine earlier this year. You know, a lot of those calves are going through very difficult conditions, hot, dusty, smoky, poor water quality, things like that. And, you know, by and large, the feedback has been very, very positive. These calves are staying very healthy despite all the environmental challenges that they're dealing with this year, which is pretty exciting to me that we've got a brand new product that, you know, people tried out and they are very, very happy with it.
What about the safety in nursing pregnant cows?
Well, that's always a big thing, especially with a modified live, is this vaccine safe in calves that are nursing pregnant cows or pregnant cows themselves? And the safety for this vaccine really goes back to NasalGen IP that's been on the market for almost 50 years. That vaccine has a very long history of being safe in pregnant cows and calves nursing pregnant cows, and all that transfers with the same antigens in the new vaccine. So we are very confident saying the vaccine is safe to use in calves that may be nursing pregnant cows. If we are maybe adding new additions to the herd and they could be pregnant, this is a safe vaccine to use in those cows to get some protection before we bring them into a new herd. We're very confident in the safety profile of the vaccine.
You want to talk about safety a little bit too?
Yeah, in both the beef and dairy industries, pregnancy is king. We don't have profitable animals unless we get them pregnant and maintain those pregnancies. So people are loath to do anything that they consider might be risky to those pregnant animals. And over again, from our launch data to field efficacy work that we have, or the efficacy work we have, we've shown that this particular product is 100% safe to use around pregnant animals. The bottom line is our producers would not take that risk if it wasn't like that. So we're confident that it's safe to use in pregnant animals and calves nursing pregnant cows.
So for anyone that has a vaccine now, or maybe they're just considering getting it and maybe using it in the future, how do you recommend them using it?
I think the hallmark for any vaccine and any switch, if you're not using a product, I think talk to your local veterinarian is always good advice. Because the advantage of discussing your disease issues with your local veterinarian and developing a relationship with him or her is they know what the local diseases are. They know how best to immunize the cattle for those local diseases. So start with your vet because they'll have the best information for you. My general recommendation is anytime that you anticipate stress or you anticipate a risk of bovine respiratory disease, these intranasal products like BOVILIS NASALGEN 3 PMH are the right tool to grab. So once again, depending on the production system, there's lots of opportunities to identify when our calves might get bovine respiratory disease. Just back up a little bit and look at your system and your procedures and say, am I using a vaccine here? Am I using maybe an injectable vaccine? And should I talk to my veterinarian or a Merck Animal Health representative about what it would look like to switch to an intranasal product and how that I might get all the benefits from that that we've talked about previously, and it might make a difference in my operation. That would be my recommendation.
Your thoughts?
I definitely agree in working with the local veterinarian. I mean, they're the boots on the ground. They know the disease pressures in the area. Making sure we have all of our other husbandry practices in line as well. Our nutrition has to be key. If we have poor nutrition, our health is going to suffer, and no vaccine is going to help. So we got to make sure we have all of our bases covered. And then, working with the local vet, design a good protocol that makes sense and that we're able to institute. I mean, if we try to make it too hard to institute, we'll never get it done. We've got to vaccinate healthy animals before the periods of stress, and we've got to do it in a way that it works for everybody involved. I think those are the key points that I have.
Okay. Do you want to tell us right quickly how it's actually administered?
You bet. So it's a 2 milliliter dose, so that's pretty standard dose for most of our cattle vaccines. Administered intranasally, so up the nostril. It can all be given up one nostril. And, we've got it available in several different presentations, from little single dose bottles as well as 10 and 50 dose presentations. So we've got something available that, everybody can manage depending on their herd size.
All right. Very good. Well, we know someone that has actually been using this product, and so we have a testimonial call in from Britton Blair joining us from South Dakota. Britton, thank you so much for joining the conversation tonight.
Well, thanks for having me.
All right, you're in Sturgis, South Dakota, and you have been using this on your operation. First of all, tell us about your operation.
Yeah, like I said, we're Blair Brothers Angus, north of Sturgis, South Dakota. Kind of a seed stock operation. We sell about 450 bulls a year. So we're background in all of our calves at weaning and retaining ownership on what doesn't go into the seed stock operation. Another part of the business is purchasing customer heifer or customer calves that are either sent directly to the feed yard or run as stockers the next summer. We also purchase customer heifers that are sold the next year as breds all across the country. So not only do we raise all the way through slaughter. We also start a lot of calves at weaning when they arrive at our place.
So why do you feel it's so important to be proactive in keeping your cattle healthy, especially when it comes to BRD?
I think it's important to keep cattle healthy because, one, that's what we as cattlemen do. I feel that's our number one job, and I think it's what we pride ourselves on. And two, a healthy animal is a productive and a profitable animal. And we have to keep those cattle healthy to stay in business, and it's important to keep them healthy as baby calves all the way through the supply chain to keep our industry viable.
Absolutely. So why did you decide to try NasalGen 3 PMH?
Well, a few years ago, we had a group of first calf heifers, and the calves were breaking with pneumonia shortly after calving at about 30 days old. I was talking with my veterinarian, and at that time, she recommended that we try Vista Once PMH intranasal and another intranasal to protect against BRSV, IBR, and PI3. She thought it would be easier on those calves and that they would respond quicker. So we've kept with that protocol for a few years, and when NasalGen 3 PMH came out this spring, I felt it was a pretty natural progression into that vaccine as we could give one shot instead of two, and we were having the same success as we did when we gave the two shots independently.
So what all did you like about the product?
Well, when we give the intranasal, it does pull those calves out of it rather quickly, and they don't seem to go through that slump you can get at about day 5 after vaccinating. We went from treating about 10 calves a day at that time to not treating any shortly after we got them vaccinated. I like the ease of the use of the product, and I like the new combined shot where I can give one shot instead of two. Something that simple does seem to help things easier when you're processing cattle and decreases the amount of vaccine you have to carry and mix up, and depending on the situation can eliminate a person.
Right, and we want that process to be as easy as possible. Would you recommend it to other cattle producers?
Yeah, I recommend it to producers all the time, especially friends and customers that could be facing similar problems to what I was. The solution that works and works well, and it's easy to administer. And I think my vet has the majority of her customers on the NasalGen 3 program at branding, whether they're having a problem or if it's just simple prevention. So yes, I would easily recommend it to other producers.
All right, very good. That's Britton Blair calling us tonight from South Dakota. We appreciate you joining the conversation. Let's take a short break right now. We have opened our phone line so you can give us a call with your questions and ask our experts whatever you like. That number is 877-731-6733. Stay tuned. We'll be right back. Welcome back to Rural America Live. I'm Tammy Arender, joined tonight by Dr. Chris Schneider and Dr. Chris Thomsen, veterinarians with Merck Animal Health. And we've been discussing BRD and the newest weapon against that from Merck Animal Health. And if you're just getting home, just in from the barn, you've had a long day, we want to kind of recap what we went over in the beginning as we open our phone lines, because if you have any questions, please feel free to call in. We're here to answer your questions, 877-731-6733. BRD is such a major issue for cattle, both beef and dairy, correct?
Yeah, and I guess the recap from my perspective is it continues to be a very, very costly disease. And we just need to come up with innovations and solutions that will help us get better. And they don't come around very often. I can count on the one hand the number of innovations that have really been brought to the marketplace in my 25-year practice career. This is one of those. It's different, it's novel, and it has the potential to directly impact the cost of BRD on our industry and also enhance animal health. So I'm excited.
All right, I can tell you are. We have Heather on the line from Nebraska. Heather, what's your question?
Yeah, thanks for having this program. I just was curious. I've used intranasal vaccines in the past, and I've noticed some of the vaccine dripping out of the nose, and I'm just wondering if that's something to be concerned about or if that's something that's normal.
Well, it's absolutely normal to have some drip back out. I mean, we know that that vaccine, all it needs to do is touch that mucosal surface on the inside of the nose to become effective. And that's where, again, the blue shadow in this product really comes into play, because you can see that actually sticking up inside the nose. So we know that if we get good contact against that mucosal surface, there's enough antigen in that vaccine that we know that we'll get a good response, even if a little bit does drip out.
All right, very good. Good question, Heather. Now we're going to go to James in Arizona. James, what's your question for our experts tonight?
Yes, thank you. I just had a quick question. What would be, if I've never used an intranasal vaccine in our calf protocol, what would be the, I guess, best and easiest way to add one?
Yeah, I think that's a really good question, James, and I think what I always recommend consulting with your local veterinarian. You know, and like I said before, they know what's going on in your farm. But to directly answer your question, James, I think wherever you might be thinking about times of predictable pneumonia in your calf crop, or if it's a dairy raising situation, predictable pneumonia you might see, these vaccines act very quickly. So back up a week or so, and then that would be the general recommendation on cadence and timing. Maybe a week before you make that big transition, a week before you wean, for example, or at convenient handling times like branding. We see these products, this particular product used in those aspects a lot.
All right, thank you, James, for that question. Again, you can call in, and our veterinarians are here for you with Merck Animal Health. And Dr. Thomsen, let's talk again about, I mean, you and both of you were mentioning that people don't like change. This is a new and different way, even though some of our callers are already using intranasal, but is it a big difference? I mean, is it the same way? I mean, I realize this is through the nose, it's not injectable, but should they be intimidated about administering it this way?
Absolutely not. They shouldn't be intimidated. It's just different, and we're all creatures of habit, and we get used to doing things a certain way, and making that jump is different. You know, if we give them a shot through a needle, we know that vaccine is going under the skin and it's going to do something. So it's kind of, you know, changing the paradigm a little bit to think that we can give something up the nose and get just as good, if not better, protection from that product. You know, a lot of times, especially in the fall of the year, if people are getting ready to give pre-weaning shots, we just run them all down an alley and vaccinate them over the side of the alley. I contend that we can probably do a better job with all of our vaccines if we catch each animal individually, whether we're giving an intranasal or not. Slowing down and doing things a little bit differently sometimes will help us to go faster, and we may end up with better results.
All right. Ivan from Kansas, welcome into the show tonight. What's your question?
Yes, thank you for having me. My question is, so right now I currently use Enforce 3, and I'm just curious, how does BOVILIS NASALGEN 3 PMH compare to the Enforce 3 I've been using?
That's a question we get a lot. And so right off the bat, we can say the 3 versus 5. Enforce 3 is a 3-way viral vaccine. It is IBR, PI3, and BRSV. We have in NASALGEN 3 PMH those 3 viruses as well. Plus, we bring along the 2 bacteria, the Mannheimia haemolytica and the Pasteurella multocida. So right off the bat, you're getting coverage with the NASALGEN 3 PMH product for the 2 most common causes of bovine respiratory disease that are bacterial. So I believe that would be an advantage. You're getting broader coverage. And I think it's been rigorously tested. It's the vaccine in the marketplace right now that has the most relevant new data on efficacy and safety. And we're quite proud of that. So convenient, 5 antigens in 1 shot versus 3, and then the package of our portfolio of safety and efficacy data that's really unmatched in the industry are 2 key benefits and differences between BOVILIS NASALGEN 3 PMH and Enforce 3.
All right, so we do have the science to back it up, and you're the data guy, so
yeah,
you know
I like
that.
Data.
Not everybody's going to do that joy reading at the end of the night on the data, but you've done it, so we know it's there. Let's go to Virginia now. Ricky, what's your question? Ricky, you still with us?
Use this on baby calves, you know, how many days old, and then do you come back and booster that when we go ready to turn out? Do we go back to our old plan, or do we have something else to go with that?
So the vaccine's labeled to be given to calves that are 7 days of age and older. So we can use it in those very young animals and get some good protection. As far as, looking at when do we need to come back with another dose or a different vaccine potentially, I think that's a question really to discuss with your local veterinarian that knows your management practices and your disease pressures right there in your area. It's hard for me to sit here not knowing all your history to determine when the best time to come back is. A lot of times when we do go into very young calves, we do come back with something else, a few months later before we turn out into a new situation where we may be dealing with different challenges.
All right, good answer. Amanda in California, what's your question tonight?
Hi, thank you for having the show as well. It's been very informative. My quick question was, on a percentage scale, how much more effective is this intranasal spray vaccine instead of a typical intramuscular vaccine?
That's a great question. And I'm going to be honest, the answer is we don't really particularly know. So to do that, you would have to directly compare an intranasal vaccine to an equivalent injectable vaccine. And prior to launch, those direct product comparisons haven't been made. What I generally say, biologically and physiologically, the attributes of an intranasal vaccine are there even if it's as effective as an injectable. The attributes that we talked about around beef quality assurance, not having to give a shot, being able to not worry as much about other vaccines we're giving at the same time, and the effect of what we call endotoxic shock on calves that we give vaccines to. The intranasal mode gets away from that quite a bit. So there are clear benefits to administering a vaccine intranasally versus subcutaneously, irrespective of one being better than the other. But I think as the year goes on, or the years go on, we'll get more direct comparative data of injectable versus intranasal vaccines. But right out of the gate, it makes sense physiologically, and it makes sense for a lot of the other attributes I just described.
Right, you say it's relatively new. You said it's been on the market about a year.
Well, actually, the NasalGen 3 PMH has just been out since January of this year.
So a lot of study will be done as you go on.
Yep.
Let's go to our next caller now. We are going to talk with David from Arkansas. David, what's your questions for our experts?
I have a question about BVD vaccine. Do you add it with it or use a killed BVD?
So that's a great question. BVD is not part of this vaccine, and several years ago there was a different 5-way intranasal vaccine on the market that did contain an intranasal BVD. What we learned when that vaccine was on the market is that our intranasal presentation of BVD did not last nearly as long as when we give it via an injectable route. So we did develop a standalone subcutaneous injection BVD vaccine that's modified live that can be given in conjunction with either NasalGen 3 or NasalGen 3 PMH to make sure that we're not leaving out that BVD protection that is so important.
All right, good question. I was thinking today about being proactive. As you guys know, we were meeting earlier today. I had to go to a dentist appointment. Of course, the dentist was wanting me to do this, this, and this, even though I will have no pain. And I'm thinking, I really should be proactive, but that's a lot of money. But I think about that tonight, and because he's explaining if I let this go on or I let this happen, that's going to be money. That's going to be serious money. So we're really talking about the same thing here, right? Being proactive, treating the cattle now before you have to treat the disease.
Absolutely, and that's the take-home message, right? Prevention is key, and if we can prevent it, we don't have to treat them. If we can prevent it, we sell the best marketable product, and we've struggled with that over the last 30 years to really kind of make big headway in the prevention side of things. We think this intranasal modality of delivering vaccines is the wave of the future. I predict that many of our products will be given intranasally when we can give them, or the future is we're learning all the time. There's innovation around intradermal, or kind of in the skin type of administration of vaccines. So we're not done innovating, but we need to innovate to get better.
Right. Keep Focus forward. We're still taking your calls. If you'd like to call in, 877-731-6733 if you have a question here in our last few minutes for our veterinarians. I'd be curious to know, is there any difference in the longevity between the injectable or the intranasal?
There is a little bit at this point. Like I said, we did the duration of immunity studies with the intranasal product, with the NasalGen 3 PMH before we came to market, and we got very, very solid data. That being said, there's some data on some of the injectable products that does show longer duration. Potentially in the future, we may look at longer durations with our intranasal. We tested them at certain time points. They were acceptable for how we felt the vaccines would be used at this point in time. Mainly, that young calf market where we know that they're going to see other vaccines as they progress through the marketing channels. And we were happy with what we had, but that's just a minimum that we know that they last. They may last a whole lot longer. And even with the injectable products where we've got, say, year-long duration for BVD and IBR, we didn't have any of that when those vaccines were launched. It was years later that those studies were done, and we looked at that. So we don't know everything at this point.
Right. Another question I have, and because you guys are from the Northwest, huge cattle country. I'm from Louisiana. We had cattle. I lived next door. I grew up on a farm. It was cotton and soybeans, but next door was a little dairy farm. Any real differences in immune systems from one area to the other that, maybe they need more of this vaccine?
Yeah, I think every region has its challenges, right? And I think the viewers understand that there's diseases they have in their area or challenges relative to respiratory disease that are higher in their particular area than the neighbor down in a different county, for example. Other things that can change things are the way we raise our animals, right? One thing is if you close calves in a barn and there's not a lot of airflow, and just like human children, you can get a lot more respiratory disease, right? So I think, once again, it's knowing the bugs in your area, knowing the diseases that are most relevant. And one thing I would add to Dr. Thomsen's last comment was Merck Animal Health is about bringing options and tools. The intranasal vaccine that we've discussed this hour is one of those tools. We have a whole bunch of other tools as well, including injectable vaccines. They have their place. I typically use intranasals on my calves when they're younger, and then I'll switch them onto an injectable program for very, very good reasons. So talk to your veterinarian, know the diseases in your area and the challenges you have, and then come up with a sensible vaccine protocol that works for you, would be my advice.
Good. We've got just a couple of minutes left. Final thoughts tonight.
Well, like Dr. Schneider just said, this is another tool in our toolbox. When I talk to veterinarians and producers, everybody's situation is different. And there is no one good cookie cutter vaccination program that's going to work for everybody. So it's good to have a toolbox full of different tools that we can pick and choose from to formulate the best options that are out there for that individual producer that works for their specific management style. So I think that's a key takeaway. Work with your local vet, tailor what you're doing to your herd, and if it's not working, make a change.
Right. Best place to go for more information?
A couple of recommendations, which there's a website like everything in this world today. It's nasalgen.com is a website, and that's where I'd send your viewers.
All right, very good. Great information tonight. I learned so much, especially how to pronounce the names. The experts. Have a great night.